Today I'm going to take a quick listen to you and do an assessment, okay?
Okay.
Alright, I'm going to start and I'm going to listen to you. Alright, breathe normal. I'm going to listen to your heart. I'm going to feel some of your pulses, okay?
Okay.
So your radial pulse. Both sides are +2 and equal. Your brachial. Which are great and +2. Alright, thanks for turning. Let me see your elbow here. I'm just going to feel it as I move. Make sure nothing. Check your fingers. Alright, I want you to lift your arms for me. Everything looks great. Okay, tell me what this smells like.
A latte?
Good. And just relax. Clench your teeth for me. Okay. Good. Good. Stick your tongue out for me. Say ah. Have this, okay? So turn your head towards my hand. Perfect. Other way. Perfect. Okay, lift your shoulders. Don't let me push down. Wonderful. I'm going to move my finger and just keep doing it. Perfect. Perfect. All right. I'm going to write something in your hand. I just need you to tell me what it is. I'll do that again. Different number, or different thing this time.
A 3.
Perfect.
A 4.
Perfect. Okay.
Sure. Soft. Sure.
Her knees and legs, make sure every joint looks good, okay? Nothing hurts when we move them?
No?
Wonderful. Well, this can...
មហានិយមគេคนทั้งหลายณมามีมามหาลาภะที่พุทธศาสนานังวะจะตังมีว่าท่านังวะพิจังวะอัตถังวะปะทังวะเอหิเอหิอาคัจจยะอิติมีมานะมามีหังทานะสิทธิไม่ได้มีเงินทองไหลมาเทมาลาภะสิทธิมีโชคมีลาภมีจุกมีใจเป็นที่รักใคร่ของคนทั้งหลายอัครายันตังสันตังอุปจติโอปัมวะสมิจโตเสริมดวงเสริมบารมีให้เจริญรุ่งเรืองก้าวหน้าในชีวิตในหน้าที่การงานโชคลาภเงินทองไหลมาเทมาเสน่ห์เมตตามหานิยมแก่คนทั้งหลายณมามีมามหาลาภะที่พุทธศาสนานังว่าท่านังวะพิจังวะอัตถังวะปะทังวะเอหิเอหิอาคัจจยะอิติมีมานะมามีหังทานะสิทธิไม่ได้พระเอหิเอหิอาคัจจยะติมีมานะมามีหังปิโยเทวะมนุษย์สานังปิโยพมานามตโมปิโยนะสัพพานานาปิยินทริยังนะมามิหังสัพเพสนาโหสนาเมตตาสุขังมหาธนังมหาลาภังภะวันตุเตนะกาโลสโนจิวะโมกโรมิจุตกังพุทธโลสังฆามิโยจะทากาโลสิวังเจยะโกโลมุขมิยะนะจาราสินะกาโลหุติสัมภโวอุอากะสะนะชาลิติประสิทธินาปจิติลาภะปัสสนาจิตาสตาหุตุปิยัมมะชิวหายัมทังราชาชิวหายันติพุสติตวาสทังสุตวาจะสุนทรังชิวหายันติยายวะปิยายันติพนมมือขึ้นนะ
Anybody's ever told you. But look at this pretty line that Maddie has on her lips between where her face. You have a beautiful contour right here that comes down into here. And I've just softly put that into there. You want them more oval. If you make them really big, they're going to add to the width of your jawline, but you could make them big so they came down like this because you have a long neck and so you could wear them. One thing, you have a beautiful square face, but you've got these pretty cheekbones right here. And emphasize them. I brought your blush up into here, a little bit up into here, to bring out that beautiful cheekbone. And our blushes are just the right color to just give that soft glow of health to you.
On the head, feeling all the way down the head, checking for any lumps, bumps, indentations. Again, have a look at the gloves to see if there's any blood there. Feel all the way down. Spine should be able to get 4 or 5 discs down the spine. Again, see if there's any abnormality. Come across the top of the clavicle. Again, feel that. That's okay. Look at the forehead, look for any bruising. Open up the eyes. Again, do they react to light? Are the pupils the same size? Look in the nose. Again, can't see any blood there. Open up the mouth, good look inside. Is there any blood coming out? Again, are there any things like false teeth that are going to have to come out? And finally, feel around the jaw. Again, look at the ears, see if there's any fluid coming out. Give them a little pinch, see if the cavity reacts. From there, I'm going to check for any blood on the glove. Feel down the ribs. Same thing. Feel all the way around the back. Using that hollow. Take the abdomen, break it down into 4. Again, pulse each of those different areas. And then all the way down the outside of the leg, halfway up the inside of the leg, feel all the way down, paying particular attention to the kneecap. Look at the colour of the skin at the ankle. Again, leave your footwear in place, just give it a little flex. Ensure recovery position, arms closest to you, up into the air, arms furthest away across the body, place it next to the cavity's neck, place your hand on top, take the leg that's furthest away, raise it up, use that as your lever. Nice straight back, using that lever, and pull the cavity across.
With your vitals first things, with the temperature. That goes under your tongue, okay. And I'm going to do your pulse. Is there any pain or anything in the knee? No. Palpate your scalp. Any recent changes in scalp? Any bumps or anything that you may be aware of? Or maxillary? Let me know if you feel any pressure or pain. Is there any pain or pressure you feel? No. Okay. Control. As well, the T-ball is present on this side. Normal here too. So as the patient is here, I'm going to check your capillary flow in your legs. Yeah, but spread.
Yeah, do you have any questions? No? Do I have your consent to proceed?
Yep.
Alrighty, here we go. Perfect. And the other foot? Perfect. So because your toes went into
temporal pulses, and they are 2+ bilaterally and symmetrical. Don't feel any kind of deformities there. All right, and tell me if you have any tenderness right here.
Nope.
And this is the frontal and maxillary sinuses in your neck, okay? Preauricular, postauricular, tonsillar, submandibular, submental, superficial cervical, posterior cervical, supraclavicular. And I did not feel any papilla. Follow me. Patient is coordinated in upper extremities. Let's do some.
And you know this, gosh, man hands are so interesting to me. Let me stand up. Are you right-handed or left-handed?
I'm right-handed.
God, you have a lot going on. You said right-handed?
Yeah.
All right. So you do this, with this hand, shake it. Like, I'm going to see, like, so this is actually surprising to me because, like, the first thing I notice is this guy is bent. You see that? And that's Apollo, which is creativity, but you're very creative. Who the fuck am I? Like, trying to figure out, you know, where you're going, who you are, and then when it breaks, it's usually around 13. Like, this is completely like something I see a lot, and it's more. So also, your headline is almost the same as Leah's. Like, it's long and it's connected to like Luna, but you have this branch that's coming off of it. Like, do you see this? It's
Yes.
like reaching up to your heart line, and that's not something that I see very often. So what I would interpret that as, how old are you?
39.
39?
I forget. I stopped counting.
It's like my favorite thing to see. It's not as strong over here, so what that tells me is if this is your dominant hand, this is kind of like the story in the making, but this is like the potential.
All right, Katie, I want to try something a little different with you now. What I'd like you to do is just let your hands relax where they are, and I'd like you to gently close your eyes. With your eyes closed, take a deep breath in, exhale, and just
Normal. I'm going to go ahead and check your lymph nodes here. All right. No presence of lymph nodes. Flat. It's warm to the touch and soft. There's a little scar here. Has that been there?
And I'm going to palpate your mandibular joint. If you could open your jaw. Okay, thank you. I'm going to palpate your sinuses, frontal and maxillary. And now hammer, but I'm just gonna kind of tap on your tendon here, okay?
Okay.
And just relax your arm, and we should get a good reflex here. If I had a hammer, this is how the arm would expand. And now we're gonna do the same thing to your bicep. That looks normal. That looks normal. I'm going to push down on the tragus and pull down on the pinna. And are you experiencing any pain?
No.
Okay, that's good. I'm going to
Just start by looking at your skin. Can I just see your hand? Nails look good, smooth, round, good cap refills, good turgor, no tinting for any bumps or anything. Hair is good, nothing abnormal found on the scalp, no bumps, lesions. Skin, hair pre-ocular, post-ocular, your occipital, your submental, your submandible, your superficial cervical.
Intact. I will now be palpating for your lymph nodes, submental, submandible, tonsillar, preauricular, postauricular, posterior cervical, anterior cervical, supraclavicular, occipital. Right. Palpating each carotid. Any tenderness, please let me know. Carotid, temporal, femoral, popliteal, dorsus pedis, posterior tibial.
Look at your legs and your feet. Feel for any edema or swelling.
They might look swollen, but they're just big.
Not big at all. Okay, yeah, I'm not seeing any wounds or ulcers or anything. I'm also gonna check the bottom of your feet. Yep, nothing there. Okay, looking at cap refill. Yep, less than 3 seconds. Gonna go ahead and check your pulses. Okay, good. Check back here. Okay, good. Alright, so I think you're gonna do alright?
Yep, and I'm going to be feeling around her skull for any bumps or do you have any pain right there?
No.
I'm also going to be checking her hair for any type of infestations, which is good. I don't see any. Check the the back of the neck for infestations. All right, I'm going to remove it. Great. Now I'm going to palpitate her sinuses, which is right here. Do you feel any pain right there?
No.
Anything right here? No. Okay. As I'm looking at her eyelids, her eyebrows, making sure her eyes and face are symmetrical. The pupils are the same way. I'm going to lift down this. Lift up your eye for me. There we go. That's all a normal color. I'm going to be feeling. Can you clench your jaws when you bite down? There we go. We'll feel that. Try to open your mouth as I press down. Okay, good job. We'll feel here for her lymph nodes. Her trachea is in line. I'm going to have her bend her neck to the side. We're looking for jugular distension. All right, can you open your mouth? Right now we're just looking for any lesions that may be open, any chipped teeth. Okay, open your mouth. Say ah. Okay, good.
And I'm going to feel your scalp now, okay? Okay. I'm feeling his scalp to see if there's any lumps, bumps, or lesions to which I don't feel any. Okay? And Mr. Sarna likes his hair a certain way, so we're going to leave it, okay?
Okay.
All right. Good. And here?
All good.
All right, good. Side. Palpating. Any pain, discomfort?
No.
Okay. And no drainage noted. Nose?
Okay.
Okay. All right. Nose is midline. I'm going to plug one side. Go ahead and breathe in and breathe out. Good. Again. Okay. Comfort, please let me know.
Okay.
Okay. All right. I'm going to start post-auricle. Okay. Pre-auricle. Okay. And I'm going to go cervical chain posteriorly, occipital, anterior chain cervically, and tonsillar, submandibular, submental. Any issues there? Okay. And now I'm going to go ahead and I'm going to feel it for your apical pulse. Okay. Regular rate. I did. Any discomfort there?
Nope. All good.
All right. And up. And in. And out. Discomfort?
Nope.
Good.
Okay.
So I want you to tell me where you feel the cotton swab.
Okay. So my cheeks.
Which cheek?
Left cheek.
Okay. And again.
Right cheek.
Okay.
It's on my left wrist area. Right wrist area. And on my left leg. My right.
Nice. Okay. And dorsal.
Woo!
They're present. Pressure.
Artery, everything on the carotid feels nice and intact. It's very nice and strong. Moving my way down, I'm going to see if there's any signs of TMJ on the jaw. I do not feel it. Do you mind opening your mouth for me? I don't feel any clicking or anything of that matter. Moving down, I'm going to look and see if there's any enlargement of the thyroid. I don't feel any. And then the trachea does feel nice and in line there. You can just please clench your jaw for me. It looks, feeling the jawline, like I said earlier, no signs of TMJ, no signs of any abnormalities in the jaw. Look, no swelling or anything there. I'm taking a look at this ear. I see no signs of drainage and everything. Joints, we're just going to move here. Good. And then the wrist. Good. And then over here. Was there any pain while we were doing this?
No.
Awesome. And if you
Assessment of her hair and scalp. What I'm looking for here is even distribution of the hair, even texture, no bald spots. I'm looking to make sure that her scalp is intact, that there are no lesions or areas of tenderness, and that of course there are no parasites in her hair, and all of that looks great. This is also a good opportunity to palpate the skull. I'm checking for symmetry, any areas of pain or tenderness, and any bony deformities, none of which I feel. So what about your cheeks? Great. Next, I'm going to palpate your sinuses. I'm going to start with your frontal sinuses here.
Tell me if there's any tenderness there. Good. And we'll do the maxillary sinuses. No tenderness there. I'll palpate Lisa's temporal arteries, both of which are palpable. Okay. For any redness, drainage, tearing, lesions, lumps, bumps. Everything looks good. Notes. You do have some right here in the back of your head, so I'm going to start there. And then just move down to these posterior cervical. All the way down into the collarbones. I'm feeling for any lymph nodes that are further back, and I'll palpate Lisa's thyroid. Try to swallow for me. Good. I can feel both lobes of her thyroid moving up symmetrically, and I don't feel any nodes. So next, I'll check her cervical spine and just palpate all the way down to each of the little joints of the toes here. This also gives me a good opportunity to take a closer look at Lisa's skin up close and make sure that she doesn't have any lower extremity edema or venous stasis, none of which I see. So we'll go on to the right side. Right. Left. Left. Right. Right. Left. Left. Right. And I'm going to check up here too. Left. Right. Good. Number in the palm of your hand, and I want you to tell me what number it is. 2. Perfect. Keep your eyes closed. I'm going to put a common household object in your hand, and I want you to tell me what it is. A key. Good. That test is called stereogenesis. Good. And last but not least, I want you to touch my finger and then touch your nose. And do it again with the opposite hand. Great.
Alrighty, so I'm going to have you bend one knee, raise it, and then do a fire hydrant, which is lean your leg bent up to the side. Perfect. So bend up and perfect. And then up to the side. Perfect. And then same with this one. So bend up and then up to the side. Perfect. And so her leg muscles, her lower extremities are 5 out of 5 for those muscles. I'm going to check your capillary reflex flow. Refill. Cap refill is brisk, less than 3 seconds. Nails, no striations, nice and smooth. Ooh, really well kept. And assessment on her. Testing, looking at her cranium from any lumps or bumps or any deformities. Everything seems symmetrical. Hair is very beautiful. It is nicely distributed. No patches noticed. It doesn't appear that she has any pests, thank goodness for that. And she doesn't appear to have any dandruff, so she palpate her frontal and maxillary sinuses. Just let me know if you feel any tenderness, okay? My hands are freezing. All right. Patient states no tenderness. I'm just going to feel your lymph nodes. So preauricular, perfect. Postauricular, perfect. Occipital, and submandibular, beautiful. Listening to the 3 different lobes in the right lobe. Perfect. Lung sounds are clear and auscultation. Alright, tummy seems soft. And now we're going to do deep palpation, which is 2 centimeters deep. Perfect. Everything's checking out good. Not feeling any abnormalities. Everything is nice and soft. 4 quadrant. Percussion, percussion, percussion. These students out here. Fire hydrants. All right, with your left one, and then your other one. All right, and then we'll do with your. All right, and then come here around here. Don't roll off the.
Resistance. So, can you pull my fingers, grip my fingers, pull me in, push me away, okay? And don't let me push your knees down. Don't let me pull your knees up. Okay, very good. And can I have one of your feet? I'm going to ask you to don't let me push your foot up. And now push on the gas. Okay, and don't let me push it up. And then push on the gas. Don't let me push you down, sorry. Now push on the gas. Okay, very good. So hit a pinprick. Can you feel that? Okay. Can you feel that? So the test, touch his nose. Now touch my finger. Touch your nose. My finger. Your nose. My finger. Your nose. My finger. Your nose. My finger. Very good. What I do is check for your Babinski reflex. And I do so, I'll use the back of my stick, and yes, his test is negative. So, that's very good.
O examinador realiza a manobra de pesquisa do reflexo cutâneo plantar e, se positivo, ocorre a extensão do hálux, com os demais dedos podendo ou não apresentar.
Inspecting and palpating the head configuration, your head is normocephalic, it's atraumatic. I don't see any lesions, no masses, and when I touch it, it's non-tender, it's symmetric, I don't see any disfigurement, and I see that your hair is well distributed on your skull, and the hair is soft and shiny in texture. I see some white hairs a little bit, but other than that, I don't see any alopecia or any lice in there. And looking at your face and your head, your skin is good. It's pink and it's soft. It's there's good skin turgor. I don't see any redness, any swelling, any drainage on your face. And I'm looking at your eyebrows. They're evenly distributed across your face. And looking at the symmetry, seeing no lesions in there. And I see that your sclera is white and your iris is round and symmetrical. And let me check your conjunctiva. And your conjunctiva is clear. There's no subconjunctival hemorrhages. And I'm looking at your eyelashes. They're evenly. All right, let me know and say now if you see my finger, okay?
No.
Perfect?
No.
Perfect?
No.
Right, and I'm going to mandibular joint. I need you to open your mouth really wide. Ah, and then close it. And do it again.
Ah.
So upon inspection and palpation, the TMJ's range of motion is active and full. And I don't hear any crepitus or any clicking, so that means the TMJ is intact. So next, I'm going to any drainage at all. The skin has good skin turgor, it's pink, and I don't see any jugular vein distensions. And also I'm going to palpate and inspect the trachea. The trachea is in midline, non-tender. And so we're going to start with the occipital. All right, and then we're going to assess for the post-ocular, and then the pre-ocular. I'm going to assess for the tonsillar, the submandibular, the submental, the superficial cervical, the deep cervical, and the supraclavicular. So draw J, all right, on foot. So I don't see any fanning, and the Babinski reflex is negative. So I'm also going to check for the capillary reflex of the toes. And the capillary reflex is
Alright, so I'm inspecting the scalp. There's no lesions, there's no redness, there's no infestation. The hair is evenly distributed. I'm going to check out your ears. Alright, so there's no lesions, abrasions. Does that hurt at all?
No.
Okay, so there's no tenderness. Check this ear. Same thing, I'm going to look into it. No drainage in the ear. Up and back, and palpate his lymph nodes. Does that hurt at all? Okay. So no abnormalities with that. But let me first check your fingers. So right now I'm assessing capillary refills. Everything is less than 3 seconds. Okay, and there's no clubbing on the fingers. All right, do you experience any dizziness? All right, so checking capillary refills. Okay. Everything is less than 3 seconds. All right, I'm gonna check his pedal pulse.
Can you raise your right leg towards the ceiling? Excellent. All the way down. Keep your left leg towards the ceiling. Excellent. All the way down. You can come back onto your back for me. And you spread your legs out and in like you're doing a jumping jack in the bed. One more time and one more time. Excellent. Okay. This is a minute.
Looking for any lumps or bumps or anything that shouldn't be there, okay? Talk to me, is that pretty hair? On the back of your neck. Okay, I'm gonna go ahead and feel for your lymph nodes while I'm here. Temperature. Tell me if you have any tenderness or pain, okay? Anything hurt? Okay, I'm gonna feel your ears now. Can you just tell me if anything hurts? Okay, I'm gonna grab your neck now, okay? Your hands. You have such pretty nails. I wish my nails would grow like that. Now I'm gonna pinch these fingers just for a while. Okay. Pinch your hand a little bit.